So at ASCO this year, I was involved in the education session on mantle cell lymphoma, and my job was to talk about the prognostic markers in mantle cell lymphoma. And so what I did was I walked through the frontline setting where immunochemotherapy is still used commonly, discussed data in the setting of BTK inhibition, most commonly at first relapse, and also subsequent therapy, so looking at allogeneic transplant and CAR T-cell therapy primarily. And what I did was highlight the particularly high-risk features of mantle cell lymphoma and how patients fare with those different high-risk features across those different groups. And what we can certainly see in the literature at the moment is patients who have a P53 deletion or other very high-risk features in the frontline setting do very badly with intensive chemotherapy, often having a progression-free survival of under a year. Similarly, if you look at high-risk features on a BTK inhibitor, so high Ki67, P53 mutation, Blastoid, pleomorphic morphology, often these patients also have a progression-free survival of under 6 months. And so thinking ahead and planning CAR T-cell therapy in those groups of patients is really important. But one thing, looking on a slightly brighter note, one thing we have seen recently is the fact that patients who have these high-risk features and receive CAR T-cell therapy and obtain a complete remission actually do seem to have very durable responses. And clearly CAR T-cell therapy looks to some degree agnostic to some of these high-risk features. And so we need to understand our treatment pathways in these very high-risk patients and offer them the optimal therapy as soon as possible in these patients. So that remains a challenge for the community. And so I highlighted some of these issues and talked around them.